COVID-19 is creating new hazards and new pressures in the workplace, especially for people with essential jobs. One response to that is a new resource guide developed by worker advocates at the Massachusetts Coalition for Occupational Safety and Health, or MassCOSH. To tell us about the guide and concerns in the workplace is the coalition's executive director, Jodi Sugerman-Brozan. Thank you very much for being with us, Jodi.
Thanks for having me.
Jodi, I want to start with what's happening with workers, especially the people in those essential jobs. You've been looking at that. What have you found?
Yeah, we've done some initial analysis. I mean, one of the things that we know is that workers right now are not getting the support that they need from the agency that should be protecting them. That's the Occupational Safety and Health Administration, OSHA. Despite having powers to create some new standards or even step in using the general duty clause, they seem to be missing in action. So we wanted to ensure that workers had what they needed sooner than later to be able to organize for the kinds of health and safety protections that they deserve at work. The guide that we created has basic information, but also information by occupation to allow workers to say, I am a grocery store worker. What kinds of health and safety protections do I deserve? And how can I then work with my fellow workers to organize for change for some of those and demand those health and safety protections. So the guide was put together by health and safety experts that we work with, and it's in English and Spanish and allows us, because we are able to put it online, it allows us to keep it in real time. Every time we learn something new, we add information to it. We know that essential workers are being impacted by this disease at a pretty significant rate. And we are hoping this tool helps provide some resources, and we provide health and safety training and technical support to workers. Our staff are working nonstop with online and virtual training and support right now.
Well, your focus is shifting because of the outbreak, because ordinarily we'd be hearing about construction accidents.
Yeah.
Now we're concerned about doctors and nurses and people who work in supermarkets or could be first responders. What do you do about that?
Well, I think for us, the health and safety issues around construction is definitely the most dangerous work you can do. That shows up every year when we look at the statistics of workers who are injured and killed on the job. But infectious disease and other kinds of issues are not completely new. And in fact, we had been prepared and had been trained to do infectious disease, health and safety prevention. Our staff had been trained and been able to provide this kind of training and support, and have worked for years to sort of ensure that overall workers in a variety of different jobs had the kind of support they needed. So our training and health and safety training is focused on knowing your rights, and we often start by doing hazard mapping in the workplace. And oftentimes health and infectious disease or other kinds of chemical issues are those that come up. And one issue that we've worked on for a long time is related to safe cleaning. And this is something that's come up again for workers, whether they're working in schools and hospitals or others. What is not only the level of cleaning they need to do to ensure their safety in these kinds of, and when dealing with things like COVID-19, but what are the kinds of cleaning agents that are safest to use? And that's different for people with asthma. We've long time worked with people with asthma to ensure that they have safe cleaning agents. They know how to clean and what kinds of products are safest for them. And we've worked a lot with the Massachusetts Asthma Action Partnership to create some fact sheets around that as well. But I think, essential workers have always been at the forefront. I think this has shined a real light on how they are consistently exposed to a variety of different hazards. And these are the same folks who are riding the MBTA to get to work. They are the ones who are needing to be out in the public being exposed and exposed through their jobs. And one thing that we are really pushing for as well is we'd like to get more data from, and we're really urging the governor and others to begin collecting data on occupation and industry of COVID-19 positive patients. Because right now, we don't have that information. We want to be able to see who is being most impacted so that we can ensure that these workers are getting the protections that they need, but also ensuring that they get the benefits through workers' compensation that they deserve. And in a worst case scenario, if they die as a result of being exposed to COVID-19 at work, that their families get the workers' compensation benefits that they deserve.
I see a potential there for also revealing racial disparities. Do you think that would be the case too?
Absolutely. We know that racial disparities are at the core of who's being impacted by COVID-19. We're seeing that. And that has a lot to do with health disparities and other historic issues, but also has a lot to do with work. We know that that people of color are much highly represented in essential worker industries. For instance, Black folks make up 7% of the workforce in Massachusetts, but 41% of those working in nursing homes as home health aides and care aides. And that is an industry that's being hugely impacted, both the patients and the workers. And we've seen initial data. We know the data on the race and ethnicity of these essential jobs, and it's very clear to us why the impact is so strong on people of color.
I want to ask you about one dilemma. If you work in a supermarket, you might be concerned about protective equipment. You might be concerned about distancing, especially from customers. But if that's not spelled out in a union contract, and even if it's not explicitly put there in state regulations, how do you negotiate those concerns?
Yeah, I think the only way to negotiate that is for workers to be able to come together and demand together the health and safety protections. And we're seeing this happen where workers come together. They seek support for writing demand letters. They organize together. They propose walkouts. They propose other kinds of impactful actions to ensure that their employers come forward and do what they need to do. We're seeing that happen in New Bedford for folks who work in the fish processing industry. Over 500 workers band together to put together letters to fish processing companies demanding the protective gear and demanding safe distancing and other health and safety protections. They're not union, but they came together to do that work.
What do you see post-pandemic? Because we might be in this interval when we still don't have a vaccine, and there will be some workers who will be more vulnerable. What has to be done about that down the line?
Yeah, I mean, I think we need to be taking health and safety seriously, always have needed to take health and safety seriously. That means as a first step, all employers are supposed to be looking and seeing, doing an assessment of the hazards that are potentially in that particular workplace. And those hazards range, but health and safety, infectious disease is a really important one. And ensuring that they're providing the training, support, and protective care. That should be going on at all times. This pandemic has just really shined a light on what happens when employers are not doing that. And as a result, workers are not getting the protection and training that they need. They're getting sick at higher rates.
Well, in the near term, you have to find a safer way to observe Worker Memorial Day. How are you going to do that this year?
Yeah, for folks who've been part of this event, it's been a really important event for MassCOSH. Every year on April 28th, we come together on the State House steps to remember all those workers who were killed on the job. We read their names, family members come, we hold a vigil and a moment of silence. This year, obviously, we cannot come together as we usually would, so we are moving the event online. We are doing it through Facebook Live, and you can find it on our Facebook page, our MassCOSH Facebook page, to find ways to participate. We will be reading the names of workers. This year, we'll also be remembering those workers who we know have died as a result of COVID-19 exposure on the job. And a family member will be speaking, as well as labor leaders within the Greater Boston Labor Council and the Massachusetts AFL-CIO. And yeah, we're all learning how to do this virtual thing. It is not going to be the same, and we hope to be able to come together later in the year to remember these workers, but we couldn't let Worker Memorial Day go past without remembering these folks, especially in light of what we're dealing with.
And finally, Jodi, if anybody wants help from MassCOSH, or if they want to get their eyes on the resource guide, what's the best way for them to do that?
Yeah, they can go to our website, www.masskosh.org. And there is a section in our website that says COVID-19 resources. That is where you can link through to get access to those, to the both English and Spanish toolkit. There's also information and contact information. We are happy to provide training, support, and orientation to that that toolkit to organizing support. If you are a worker who's looking to organize with fellow workers, you're not in a union and need that support, we can help you with that as well. And we really encourage people to be reaching out. We've got multilingual capacity. We can help for workers who are in English or Spanish. Please work out. We can definitely be a resource, and we want to be a resource.